the prevalence of cough medicine misuse, and I'll talk about codeine as well as DXM, understand some of the risks associated with DXM misuse. I probably won't spend much time on the third bullet because that had to do with a presentation I did for medication-assisted treatment, and then discuss some strategies to reduce the risk of DXM misuse. So just talking about misuse, World Health Organization definition, it's using the substance. Now we're not talking about diversion here. We're talking about people who have a medication and they're either taking it more than what there should be. They're using it by some route that's not recommended, injection, intranasal, smoking. And then you can see by extraction is some things that people do in the medication-assisted treatment world. So we're going to talk about codeine first. So I always when you're working with, I always ask people still about slang terms that they use. But it's kind of helpful to know about slang because sometimes your peds or young adults or even adults will refer to things in slang. So codeine oftentimes is called purple drank, scissor, lean. Like I just mentioned, there's a lot of pop songs right now that refer to lean. It's very glorified. And essentially it's a term given to recreational drug that generally includes high dose, sometimes 25 times the recommended dose of codeine and promethazine. Did I say that right? I always get I can't say these words. Both central nervous system depressants. And oftentimes it's mixed with a carbonated soft drink or alcohol. So it's very common that people, again, my Akron students will use this as too. They'll talk about getting a red Solo cup, putting codeine-based cough medicine, putting Jolly Ranchers and things like that, and Sprite, and then drinking it as opposed to alcohol at a party. And the combination of the two drugs in the cough medicine, we believe act in a synergistic manner to really create more of a central nervous system depression and risk with that. Typically the onset is about 20 minutes and it lasts for 4 to 6 hours. And these are some artists, DJ Screw, Big Mo, Pimp C, who were really well known, who all popularized codeine-based drink, and they all died from it. So just something to kind of think about, the cautionary tale, but there's still artists glamorizing it, as I say, right where we speak. And there was such a kind of a risk or concern about it that the pharmaceutical company Actavis ceased all production in April 2014. But of course, many pharmaceutical companies did not. And essentially your way of sort of dealing with an overdose would be very similar to other opioids, where you're naloxone, you're stabilizing the airway, trying to promote breathing and circulation. So here's some of the effects in the way in which people would drink codeine-based cough medicine. You got euphoria, motor skill impairment, lethargic, disassociative feeling, slowed sense of time, meiosis, hypoactive bowel, hypotension, bradycardia, obtundation to agitated delirium, and death due to respiratory depression. So those are some of the effects associated. So in terms of codeine medicine, so this is a 2011-2012 survey. As a large public university, about 2,400 students. And about 6.5% of those students had endorsed misusing codeine-based cough medicine. Interestingly enough, there was a real sense that this was predominantly a drug misuse by African Americans and blacks, and this is one of the first studies that sort of put that on its head a little bit. First of all, there was a higher rate of males who endorsed misuse than females. 5.1% of Asian Americans, 5.4% of African Americans, 6.1% of whites. Larger than expected rate of misuse with Hispanics, Latinas, and Native Americans. So again, this had one of these studies where we had kind of thought, through stereotypes and other things, that was predominantly a Black and African American drug problem, and this kind of led us to think differently about that. 12.2% had been raised in urban environments, 7.3% in suburban, and 4.0% in rural. High rate of sexual minority, and this is something in the substance use world is a finding that comes up really frequently. People who identify as a sexual minority are much more likely to abuse or misuse substances. Many people would argue that's because of heterosexism and homophobia and the distress associated with being a sexual minority. But it's a higher risk population in terms of substance misuse. So this was another survey. I always say I would like to have done this study where you get to go sample people at electronic dance music parties in New York City. But they surveyed about 950 mostly white college and educated individuals at these parties, and essentially they found that 23% of these folks had misused opioids at some point in their lifetime, 5.0% in the past month, 16.4% willing to use again. In terms of like the codeine-based cough medicine, 7.5% had endorsed using it in lifetime, 0.8% in the past month, and 6.4% were willing to use again. And this was kind of an interesting finding from this study, is that older participants were much more likely than younger participants to have misused opioids in the past month, which is really what they were expecting, or the past year, sorry, wasn't exactly what they were expecting. So now we're going to move on to DXM. And like I mentioned, just this week, I asked a group of athletes, you're thinking college athletes, people who are taking care of their bodies, people who are student athletes, keeping a certain GPA. And there was about half of the folks in that room said that they misused DXM on occasion. And they discussed it in very glowing terms. So yet another thing, but they wouldn't have talked about it until I asked about it. And they're like, oh yeah, that too. Yeah. So people some of the slang is robo-tripping, skittling, because people put Skittles in it. Dex or DMX, who was a hip hop artist, and Tuss. And essentially they're slang terms for the over-the-counter DXM products. It can be swallowed, of course. Oftentimes, like the clients I saw this week mixed it with alcohol too. Pretty common. Or soda. Can also be injected. Often misused in combination with alcohol and marijuana. Exactly what the students I just saw said that they did. They smoked weed, they drank alcohol, and they drank DXM all together at parties where that was a normal thing happening at the party. It works in similar ways to ketamine and PCP, though it's also considered an opioid. It's widely used among adolescents and young adults because it's easy to get, it's cheap, it seems safer, it's popular, it's easy to hide. So for all the reasons why adolescents and young adults would do things, it kind of maps onto that. There was some discussion with the FDA about scheduling DXM in 2010, though ultimately the decision was not to, citing the economic and public health benefits. And actually Ohio right now, it seems like it's in limbo. In the Ohio House, there is a bill to make it to where people have to be 18, or you cannot buy DXM without a prescription unless you're 18 or over, and you would have to provide an ID. Though it seems that's been stuck in the Senate since about 2017. So at this point, pretty much your 15, 16, 17-year-old folks could go in and buy DXM and not have any, any parameters around that. I put a bulletin there, or a link there, in terms of how some people become psychotic when really using DXM at a high rate or high amount. So at normal doses, it's quite safe. It activates the cough control region of the brain. Obviously, that's why it's used for the way it is. At high doses, we're talking 10 to 50 times the suggested dose. People have hallucinatory and dissociative effects. That, again, it's similar to PCP and ketamine. That's what the students I just saw and my people I work with normally, that's what they're after. They're trying to drink to the point where they have that hallucinatory and dissociative effect. A lot of student athletes I've heard will use it because it does not show up in typical drug screens. And basically anybody who is for some reason needing to drop urine, as we would say, for somebody, may be more at a high risk for this because they know that. Student athletes already know this isn't coming up in a drug screen, so they don't have to worry about it. It can, in very high doses, create a false positive for PCP. Let's see. Therapeutic approach to intoxication really focuses on reducing the symptoms. So sometimes people are given a short-acting benzodiazepine or a low-dose antipsychotic just again to counter the effects of basically overdose from DXM. Some of the effects are the impaired vision, slurred speech, sweating and fever, irregular heartbeat, nausea, impaired judgment, memory loss, rapid eye movements, hallucinations and dissociative effects, coma. And there has been a few cases reported where there was fatal overdoses associated with pure DXM. And just so you know, yes, people can get pure DXM powder via our friend the internet. So that's a thing too. And also, obviously there's other substances in cough medicine like acetaminophen that can create issues like renal issues if you're overusing DXM products. So this is some of there's not a ton of research on DXM yet in terms of like the effects of misuse, but this is one study where they look basically at difference in cortical thickness and subcortical gray matter for DXM-dependent adolescents, which was the 38 folks, and then folks who had not used DXM in that manner. And they found essentially the DXM group had increased cortical thickness in gray matter in the volume in comparison to healthy control. And a lot of this would suggest that, or what we think is happening is that a high rate or high amount of DXM use interferes with that kind of normal synaptic pruning that happens when healthy brains are maturing. And particularly in those regions that are really developing for our adolescents and young adults, the prefrontal cortex and occipital cortices, the thalamus. And there's also, they found that those brain patterns in those subjects also seem to be associated with impulsive behavior, which would kind of make sense based on prefrontal cortex development. But so, early returns, but there's some belief that yes, if young adults and adolescents are using DXM, misusing DXM, that it can really impact that kind of normal brain maturation process, and particularly in the cortices related to impulse control and things like that. And it did correlate with the age of initial use. So in 2017, according to the drugabuse.gov website, DXM cough medicine was misused by 2% of 8th graders, 3.6% of 10th graders, and 3.2% of 12th graders. This observational cohort study, 37 sites, and this was basically a bunch of different ED settings, found that 13 to 18-year-olds who presented at ED between 22 and 13 reported that DXM was most commonly misused legal medication that led to that ED situation. I'm not going to go into that just because it's a little bit outside the scope of this. So then, I'm going to move on from that. Oh, so I think essentially, I think with DXM and codeine use, a lot of the same type of interventions would be effective in terms of what you'd be doing with substance use disorder. So some of the first things I do present a little bit of the research, like, the education that can be tolerated around what we think may be happening with DXM use and brain development. Some people buy that, some people don't, right? I may ask people about like unexpected situations that occurred through DXM misuse. And sometimes hallucinations can be scary for people. So sometimes just kind of focusing in on that, having them talk through that a little bit more, having them talk about that experience of being out of control, can be helpful for people. That may be something that someone's minimizing, but if you can kind of draw that out, they might be more inclined to really process and experience. And I've had some folks who that was pretty scary for. I think also just, again, trying to think about sort of what are the benefits that you're getting out of DXM use? What is the draw? And are there other things that you could do that might help you feel in a similar way, but without those type of consequences? So with dissociation, hallucinations is harder, right? But with the dissociative quality, there are people, and I have clients now who get really into meditation and over time begin to have that same kind of experience, and find that to be really rewarding, and more so even than using substances to get that. Not every person I work with, and it certainly takes some time. And on the codeine side, I think a lot of people I've come in contact with did not understand that codeine was an opioid, especially your young adults and your adolescents. They didn't appreciate the fact that the risks associated with misusing codeine-based cough medicine, because they did not think that it was an opioid or had any kind of opioid-like qualities. So sometimes just education around that, around the central nervous system depressant risks, the risks associated with essentially what people would say catching a habit, right? Into where they ultimately then can't stop without feeling significant withdrawal. So I found that a lot of the college students I work with did not know, and that literally just learning, and some of them have real fears, especially in Ohio, around becoming opioid dependent, that was the intervention really, because they didn't know, and now they know, and now it's scary, and so. But it's tough. I find more challenges with DXM, frankly, than with codeine, in terms, because there's a lot of them don't see a lot of drawback to it. So that's